Bowel cancer, 8 symptoms that require urgent investigation. Feeling of incomplete emptying? Stay with me until the end of this video. You'll discover essential information you never knew you needed. Detecting bowel cancer early dramatically increases survival rates, yet many dismiss crucial warning signs as minor digestive issues. When my uncle experienced persistent digestive changes, he hesitated to see a doctor until symptoms became severe. His delayed diagnosis taught our family the importance of recognizing early warning signs. Colorectal cancer remains the third most common cancer worldwide, with over 1.9 million new cases annually according to World Health Organization data. What's truly concerning is that many early symptoms mimic common digestive complaints, leading to dangerous delays in diagnosis. Research published in the British Journal of Cancer found that when detected at stage 1, bowel cancer has a 90% 5-year survival rate. This drops dramatically to just 10% when diagnosed at stage 4. Recognizing these 8 key symptoms could quite literally save your life. First, persistent changes in bowel habits lasting more than 3 weeks. This includes diarrhea, constipation, or changes in stool consistency. A study from the National Institutes of Health found that 89% of colorectal cancer patients reported noticeable changes in bowel patterns before diagnosis. Second, feeling of incomplete emptying after bowel movements. This sensation, medically termed tenesmus, occurs when tumors in the rectum create the persistent feeling that you need to pass more stool even when your bowel is empty. Research from the Mayo Clinic indicates this symptom appears in approximately 68% of rectal cancer cases. Third, blood in stool or rectal bleeding. While often attributed to hemorrhoids, any blood should be investigated, especially if it's dark red or mixed with stool. A comprehensive review in the Journal of Clinical Gastroenterology found that 89% of colorectal cancer patients experience rectal bleeding at some point before diagnosis. Fourth, unexplained weight loss of 10 pounds or more. When cancer cells consume energy and affect your metabolism, unexplained weight loss often follows. According to the American Cancer Society, unexplained weight loss occurs in approximately 40% of people with colorectal cancer at the time of diagnosis. Fifth, persistent abdominal discomfort, including pain, cramping, or bloating. A landmark study in the Annals of Internal Medicine found that 77% of colorectal cancer patients reported abdominal discomfort as an early symptom, often mistaken for irritable bowel syndrome or indigestion. 6. Fatigue and weakness that doesn't improve with rest. When bowel cancer causes blood loss over time, anemia develops, leading to persistent fatigue. Research from the Journal of Clinical Oncology reports that approximately 60% of colorectal cancer patients present with iron deficiency anemia at diagnosis. 7th, narrow, pencil-thin stools. As tumors grow and narrow the intestinal passage, stool shape often changes. Gastroenterology research indicates this symptom appears in roughly 43% of cases involving tumors in the distal colon or rectum. 8th, unexplained anemia identified through routine blood work. Even without noticeable symptoms, anemia can be the first detectable sign of intestinal bleeding. Studies from the National Cancer Institute show that unexplained iron deficiency anemia increases colorectal cancer risk by approximately 2-3 times. Importantly, these symptoms don't automatically mean cancer. Many conditions share similar presentations, but persistent symptoms warrant prompt medical evaluation. Research consistently shows that early detection significantly improves outcomes. If you experience these warning signs, consider these practical steps. Document symptoms carefully. Track frequency, severity, and any patterns in a symptom journal. Consult healthcare providers promptly. Don't delay seeking medical advice for persistent symptoms. Be specific during consultations. Describe symptoms precisely rather than minimizing concerns. Ask about screening options. Discuss whether colonoscopy or other screening methods are appropriate. Know your family history. Inform doctors about any family history of colorectal or other cancers. Advocate for thorough evaluation. If symptoms persist despite initial treatment, request additional investigation. Modern diagnostic approaches include traditional colonoscopy, less invasive imaging tests, and innovative stool-based DNA tests. Medical advancement continues to improve early detection capabilities. Remember that risk increases with age, particularly after 50, though concerning trends show increasing rates among younger adults. Family history, inflammatory bowel disease, certain genetic syndromes, and lifestyle factors like diet, physical activity, and smoking also influence risk profiles.